Hello, my name is Kikon. I'm the Cihsr Humble TV. Idia Chennai Diwa Ajilaga Nagmis News Roundup. Northeast Region State Bank of India laga General Manager L Thangboibra 50 bisna aro 50 oxygen cylinders regulators milaigina Christian Institute of Health Sciences and Research ke dishe. Cihsr laga Director Dr. Sedevi Angamibra Thangboi ge ta laga appreciation janai dishe. Aro bisna laga quality bishi bhala se taikan afford kuribole tukpa ekta Thangboibra dishe koigina bi janai dishe. IB idulaga details reporter ke Christian Ogihologu de chaniwa.
The country was passing through a very traumatic stage of pandemic in the second wave. So everybody was a witness to that. And at that point of time, one of the main difficulty that the country was facing, the hospitals, the clinics and government hospitals and everything was, one of the thing was the lack of ICU beds and also the oxygen. So you might be aware that a lot of things we might see in newspapers how people suffered and people lost their life. At that point of time, we also received, I think in the month of May, we received proposal from your department, Cihsr. So then the State Bank of India came forward. We are also looking forward to how to help the community in terms of providing infrastructures by way of providing ICU beds, which are very costly by itself, which comes around 70,000 plus and all that. And again, if you talk about the oxygen supply, again, this is something very rare commodities which was never felt before. Only this pandemic has taught us that where are these things come from and how it is being manufactured and how these things are being supplied. So at that point of time, we are very happy and State Bank of India is very grateful that we can come to the help, to the people and come down with the people and who are closely associated working with this kind of health institution like your organization. So today, we are very happy that through State Bank of India Foundation, we could provide around 50 ICU beds and again 50 oxygen cylinders. And I'm sure that this will go a long way in helping the institute providing one of the best medical facilities who are in dire need of treatment in a critical time. So we at State Bank of India, our SBI Foundation is the channel through which we are funding the this kind of assistance. And everything has been, of course, proposals and recommendations have been routed through us.
We are very grateful to them for having gone out of the way to provide us with this. There have been actually very little of, hardly any forms to fill up or anything like that, So otherwise it can be quite difficult sometimes filling up a big project proposal and all that. So we are very grateful. We hope that it's already in use, whatever is coming, and we are actually expanding our oxygen capacity and beds which will be supported by oxygen with pipelines. Once they're all done, then most of it will be in use. And one thing is, in anticipation for the third wave, if it happens, it may not happen, but if it happens, then we are a lot more comfortable now. We think we can handle things much better. Plus, in the long run, the Cihsr hospital, it doesn't belong to anybody. It doesn't belong to any private party. And this is one which can, all of our effort is to ensure that this facility grows and becomes a blessing and a support service facility for the entire region, not only Nagaland, but also the rest of the region.
Toman huni paishe itu Northeast Region la SBI la manager Cihsr ke tan itu 50 ICU beds along with 50 gas cylinders contribute kurishe aru director Cihsr la director Dr. Sedevi Angamirawi tai la khushi kotha janai dishe aru bisna khan hoilibi itu bishi dam la se ina koine taiwi koishe aru ahia din khan deule bishi diri chulaine jabo paru inawi kwabi huni paishe itia karne mani moi reporter ke Christian Yoke with camera person Johnson.